Nearly everyone at some point in your life will experience a range of reaction, especially after some type of trauma. And in most cases, well, you recover after those types of symptoms. But in some cases, the symptoms can become downright debilitating and can affect your life. If you're one of those people, you could be suffering from post-traumatic stress disorder. And that's what we're talking about today with our coastal expert from Horizon Behavioral Health. He's a psychiatric physician's assistant, and we're so glad to have him with us today, Jeff Frey. It's so great to see you, Jeff.
Natalie, thank you for having me today, and it's my pleasure to discuss post-traumatic stress disorder.
So those are big words. So what exactly is post-traumatic stress disorder for some of our viewers who may not be familiar with it?
Well, we'll keep it simple. We'll call it PTSD instead of post-traumatic stress disorder. But essentially, it's a mental health condition that affects one after an individual has been exposed to a life-threatening event or a traumatic experience. Initially, this was first observed back in World War I with our soldiers, and the medical personnel then called it shell shock. As the soldiers progressed into World War II, it became known as battle or combat fatigue. As we moved forward, it was realizing that it's not only confined to military personnel, but anybody who's experienced a life-threatening event, either personally or has been a witness to some type of event, can suffer these symptoms.
How is this diagnosed?
Well, initially, if you've been exposed to a trauma of some sort, you have a reaction, depression, anxiety, stress, and that can last for 3 days up to a month. If these symptoms tend to last longer than a month and they've interfered with your ability to do your daily life or your ability to do your work, then we may be looking at post-traumatic stress disorder, or PTSD. We can go into the symptoms here in a minute, but a lot of your family doctors, family practitioners, your primary care people can do the initial screen, and if they feel that's what you have and they're not comfortable treating it, then they can refer you to psychiatric care or mental health care for further evaluation and treatment.
So you mentioned symptoms. A lot of viewers watching right now, what are some specific symptoms when we're thinking about PTSD?
Well, there are basically 4 categories of symptoms. The primary ones are what they call the re-experiencing symptoms or the intrusive symptoms. And they refer to the flashbacks where you mentally go back to the site or the time of the incident. They can have nightmares related to the traumatic event, and those nightmares can be pretty serious. You've all heard about some of the veterans who find themselves choking their wife in the middle of the night and they wake up. That's actually possible. And thirdly, you can have reaction to just regular thoughts about the traumatic event. All those are considered intrusive or re-experiencing the event. The second criteria we deal with are the avoidant symptoms, where say you were in a serious car accident, you may not want to get in and drive, or you may not want to be a passenger in a vehicle because of that. That's called avoidance. And the third category is called what they call negative or mood or cognition issues. You can have memory lapses, memory problems, forgetfulness. You could have negative thoughts about yourself, like, why did this happen to me? I'm not worthy, maybe I shouldn't have survived, survivor's guilt type feelings. You could become depressed, you could become irritable, angry, and you could feel detached or disconnected from your family and surroundings. And the final category of symptoms are what they call arousal or increased arousal symptoms. And this could be the classic hypervigilance where you're kind of looking over your shoulder, or the veteran who hears a car backfire and he crouches down thinking it's a gunshot. You can have difficulty concentrating, relating to memory problems.
Let me ask you this, PTSD, is it something that can be treated? And if so, how is it treated?
Oh, most definitely it can be treated, and the mainstay is therapy with a licensed therapist, counselor, psychologist. And one of the 3 most common therapies are prolonged exposure therapy, cognitive processing therapy, and eye movement desensitization and reprocessing therapy. Now, to treat the coexisting symptoms of PTSD, which include depression, anxiety, lack of motivation, lack of pleasure, and things that you once enjoyed, those symptoms, we turn to medications. There are a lot of options out there, but again, the mainstay to treat the actual PTSD symptoms is the therapy. Medications are used to augment that to treat any of the coexisting symptoms.
So Jeff, a lot of viewers watching right now, and if they are sitting at home and they are experiencing some type of symptom, or someone they love, they're watching them experience symptoms, what would you say to them right now? Because I know that Horizon Behavioral Health really specializes in PTSD.
The first step I would do is to talk to your primary care provider, your family doctor, and if they can do some screening and they can refer you to us or to additional therapy or treatment if you needed. Another option is that if you go to our Horizon Behavioral Health webpage at www.hbhga.com and click on the resource tab, it'll bring down a PTSD questionnaire that you can answer yourself, and this will give you a score and let you know whether you possibly are suffering from PTSD.
Well, we want to thank you for joining us on The Bridge today. It's always great to see you. Such an interesting topic, PTSD. Thank you so much for being here.
Natalie, thank you for having me, and I hope we were able to help some folks out there get the treatment they need.
If you'd like more information on post-traumatic stress disorder or Horizon Behavioral Health, all you have to do is go to our Coastal Experts page. You'll find that on WSAV.com.